This is a problem that dates back to 2003, when the then government made the decision to give consultants the right to opt out of working at weekends, as something that nurses don't have, that paramedics, ambulance drivers don't have. Indeed, no one else in any emergency service has. And the result is a Monday to Friday culture in many parts of the NHS that mean, for example, that if you're admitted on a Sunday, you have a 15% higher chance of dying than if you're admitted on a Wednesday. And I have yet to meet a doctor who thinks that's acceptable. Many doctors do work at weekends, often without thanks or recognition, and this is about a contract that recognises those efforts and brings back the professionalism and the sense of vocation into that contract that many people thought was lost in 2003 when those clauses were changed.
But as the BMA says, the big problem with this is you just haven't got enough staff to deal this through. I mean, they're effectively saying if you make people work at a weekend, it means they're not going to be available to work at some point in the week. Therefore, you're robbing Peter to pay Paul.
Well, we've got nearly 10,000 more doctors in the NHS compared to 5 years ago, so we are recruiting more doctors to the NHS, but it is incredibly inefficient to have a service that cranks up on a Monday morning, starts to wind down after lunch on a Friday. And if you are admitted to hospital on a Friday and you have an important test, and then you're told you're going to have to stay in hospital for the Saturday and the Sunday, and then you won't get a decision on whether you can leave hospital until the Monday or the Tuesday when a senior consultant can come and see you. No consultants want that for their own patients, and that's why moving to a 7-day NHS is supported by the Royal College of Surgeons, the Royal College of Physicians, the Royal College of Emergency Medicine, as being something that's better for patients and better for doctors.
A 7-day NHS isn't just about consultants, isn't just about doctors, is it? I mean, you said there about if you have a test on a Friday, you're not going to have a test at a weekend, are you? The BMA saying, you know, that the big problem here is things like a lack of diagnostic procedures at the weekend.
Well, we need to sort out that, and we need to sort out the way handovers are done. But an absolutely critical part of this is making sure that we have senior consultant cover at the weekends, because sometimes people go in on a Friday and, you know, they're going to be ill because otherwise they wouldn't be in hospital, but they may not look in a life-threatening situation, but then they deteriorate over the weekend, and by the time it gets to Monday, it's got too late. I mean, at the heart of this is a big choice we have to make, because we had a terrible tragedy with what happened at Mid-Staffs. And we could sort of learn the lessons and say we will try and make sure that doesn't happen again. Or we could do something bolder and say we're going to make it a turning point when the NHS resolves to have the safest hospitals anywhere in the world. And the truth is we have these avoidable deaths in this country, but they have them in other countries as well. But nowhere is looking as hard at this problem as the NHS in England. And I want nothing but the best for our NHS. I think that's what doctors want. It's bringing back professionalism and a sense of vocation into those contracts. And I think if we do that, what's best for patients is best for doctors, and it means that we can continue to be very, very proud of the NHS.
You're not going to get a single person, I would have thought, who would argue against the idea of having a better and safer NHS. But the BMA says it's just too simplistic to sort of pile the pressure on consultants when it is an overall consistency of quality of service 7 days a week, which is what you need to be focusing on.
Well, this is about having a consistent quality of service, but if you talk to the people who run the hospitals, they say one of the factors, not the only factor, but one of the significant factors is actually being able to get consultants willing to work at weekends. Many do, and as I say, they're often unrecognised and unthanked for that work. But at the moment, consultants have the right to say, no, I'm not going to do any work at weekends at all. It's something that nurses don't have. It's something that paramedics, as I say, other people working in the health service don't have that right, and it makes it very difficult for hospitals to do this. I should say the hospitals that have succeeded in doing this, places like Northumbria, like Salford, like Sheffield, actually see the morale in those hospitals go up. Because when you're doing a better job for patients, that makes it a much better working atmosphere. So I think what we'll see is this actually has growing support in the NHS.